Diabetes mellitus is a complex and systemic disease for which two complementary and interdependent prerequisites are essential: patient engagement and glycometabolic control. Significant technological progress has revolutionized the possibilities for control, thanks to sensors capable of instantaneous glycemic monitoring and devices designed for real-time data transmission. In parallel, after a long period of stagnation, pharmaceutical research has developed new molecules endowed with selective action and the ability to intervene at different levels of the intricate pathophysiology. This video therefore aims to provide a concise and panoramic introduction to diabetes, particularly type 2, highlighting the clinical implications of greatest impact on quality of life and identifying the main strategic approaches. Diabetes mellitus is characterized by persistently elevated levels of glucose in the blood, that is, high blood sugar levels. The most well-known forms are type 1 and type 2. Type 1 diabetes accounts for 10% of all cases, typically appears in childhood, and is caused by the autoimmune destruction of the beta cells in the pancreas, which produce insulin, the key hormone in regulating blood sugar levels. Type 2 diabetes tends to develop in adulthood and is usually associated with a condition known as insulin resistance, particularly favored by obesity. The rise in childhood obesity is a serious issue leading to an earlier onset of type 2 diabetes. Another common form is gestational diabetes, which is linked to pregnancy. In Italy, diabetes is more prevalent in the south and affects 10% of men and 7% of women. An estimated 4.5 million people have diabetes, with 1.5 million undiagnosed cases and 4 million people at high risk of developing it. The risk increases with age, rising from 3% below the age of 50 to 21% over the age of 75. The aging population, favored by the increase in life expectancy and declining birth rates, raises concerns about a worrying increase in cases. Diabetes is a chronic disease that affects the entire body. Sometimes its first manifestation is an infection that tends to persist. The main targets are the large vessels, with an increased risk of diseases such as angina, heart attack, stroke, and vascular impairment in the lower limbs. The small vessels, particularly in the retina and kidney, which suffer impairment. The liver. The autonomic and peripheral nervous systems, for example with sensory disturbances, difficulty in bladder emptying. The immune system, with recurrent infections, particularly respiratory and urinary. Often in the initial phase, diabetes does not involve symptoms, and in some cases, it is even discovered after 10 years. The primary blood tests are blood glucose levels, glycated hemoglobin, and the glucose tolerance test. Upon diagnosis, it is essential to undergo the prescribed blood tests and instrumental examinations by the physician, necessary to monitor the course of the disease, such as an electrocardiogram, ECG, and an eye examination. Nowadays, blood glucose levels can be monitored without blood sampling and can even be automatically transmitted to the attending physician. The basic therapy for type 1 diabetes is insulin, which every patient learns to manage based on meals and their daily routine. An appropriate dietary regimen is then essential, which, contrary to what many think, is not devoid of sugars but favors complex carbohydrates. For type 2 diabetes, the first approach involves changing to a correct lifestyle, based on proper nutrition and physical activity. Today, many more hypoglycemic drugs are available, which allow for personalized therapy and more effective metabolic control.